Since the beginning of the pandemic, clinicians and researchers raced to find a safe and effective vaccine that would alter the course of the pandemic. The following chronicles the journey of UC Health's role in the Moderna Phase 3 COVID-19 vaccine trial, from the early days in August 2020 to the present day. 9 a.m., August 25th, 2020, Day 1 of the vaccine trial. It has been over 5 months since the new coronavirus made its way into our region. Since then, our lives have completely changed. People are wearing masks, social distancing, and even working remotely. Hospitals are beyond capacity. The world as we know it is no longer the same. For the first time, however, there is hope. A vaccine study is underway at the University of Cincinnati and UC Health.
It's very exciting that Cincinnati is part of this and that our citizens can be part of this and that they can be the heroes and heroines of the COVID pandemic by helping us to try and find an effective vaccine that will prevent this disease.
Earlier this morning, 37-year-old Jarrell Marshall, an IT professional, wrapped up his daily gym workout with one of his friends. In a matter of an hour, Jarrell finds himself in the clinical trial clinic filling out paperwork and speaking with his new trial administrator. Before receiving his first dose, he reviews and completes a lengthy consent form and undergoes a physical evaluation.
We just want to be a part of it. Is just, we're all in it together, like trying to help get things back open and everybody get back to as normal as possible.
Meanwhile, the pharmacy team prepares doses of the vaccine or placebo. Each participant receives either the Moderna vaccine or a placebo, a controlled substance that is different from the actual vaccine.
From the pharmacy perspective of the trial, we are going to be serving as the unblinded team. We are going to be preparing the vaccine for administration, so drawing it up in a hood, and then I will actually be administering it to the patients directly.
Once the dose is ready, pharmacist Mary Burns delivers it and administers it to Jarrell, making him the first participant in UC Health's Moderna vaccine trial for COVID-19.
I just feel extremely grateful to be a part of the University of Cincinnati research team, to be a part of IDS, and it just reinforces what I went to school for, which was to help people, to give people hope, and honestly, it's just a privilege.
Jarrell will return to UC Health in 28 days to receive his second injection. Until then, he needs to continue to monitor his symptoms and check his temperature. All of this is going to be logged in his electronic diary.
If you're gonna try to help people, you just do it. Like it's not that you need a lot of recognition or anything for it. You just do it, and hopefully, everything will work out and for good, right? So.
The trial is scheduled to run for 25 months. We will vaccinate people now and about a month from now, and then we will follow people to see whether or not the vaccine is safe and whether it works to prevent them from getting infected with COVID or for having more serious problems with COVID if they do get infected.
8:25 a.m., December 23rd, 2020. Moderna vaccines arrive at UC Health. Recently, the U.S. Food and Drug Administration granted Emergency Use Authorization, EUA, for the Moderna vaccine to treat the coronavirus. There is a sense of optimism on this chilly winter morning. In a few minutes, UC Health is going to receive their first shipment of the Moderna vaccine. The pharmacy team gathers on the back dock at UC Medical Center to collect the shipment of 3,100 doses of the vaccine. Pharmacists will immediately prep the vaccines to go into the arms of UC Health's frontline healthcare workers from UC Medical Center, Westchester Hospital, and Daniel Drake Center for post-acute care.
So in our distribution process, the COVID vaccine is stored in the deep freezer. We need to thaw it prior to administration. So some of our activities this morning was unpacking vaccine, relocating it to refrigeration in preparation to administer our first doses.
Later in the morning, healthcare workers, including doctors, nurses, technicians, and other frontline support service staff, line up through a hallway in UC Medical Center to receive their vaccine. These frontline staff members take care of the sickest patients. They will now have protection against a virus that has affected the lives of millions of people around the world.
It's really exciting that UC Health is part of this historic moment where we really are starting to vaccinate and prevent the spread of COVID-19 in our community. As an academic health system, we've been at the forefront of making sure that we're leading in research and serving our community, and it's really exciting for us to be part of this historic moment.
After getting their vaccine, pharmacists hand them a card that verifies that they received the vaccine and notes when they will need to return for their second dose in 28 days. We still have a long way to go in overcoming the COVID-19 pandemic. The hard work continues for UC Health's frontline heroes. However, there is light at the end of the tunnel. Thanks to the commitment from our researchers and clinicians, the Moderna vaccine is going into the arms of healthcare workers, patients, and members of the community.
I've been at the university for nearly 50 years, and it's been tremendous, the support from UC Health on health issues.
I think we'll want to see friends and want to have more normal life. And I think this is the way that people just get on the wagon and get their shot.